everybody to this month's Ladies Lunch and Learn. Happy Thursday. We are very excited to have you all here and have our guest speakers and to be talking about the new Sustain 340B Act. You can see some poll questions are launching as well as handouts are coming up. But just really wanted to remind you all of the intention of the 340B Ladies Lunch and Learn. It's meant to be a place for us to learn together, to grow, to build community, to be supportive of each other, and really meant to empower us as women within the 340B space. And so we've got members of the 340B community from different stakeholder groups here today. Just really want to make sure that everybody is respectful in our conversation and respectful in our chat. And so with that, we will start I'll bring up the slides and we'll jump right into things. So as we said, we're going to be talking about the Sustain 340B Act. And if you haven't already, if you just want to respond to the poll, so let us know who you are. I'm Felicity Homestead. I'm the CEO of FQHC 340B Compliance. Lanika, if you want to go next.
I'm Lanika Ellis. I am the Director of External Audits at FQHC 340B Compliance.
And I'm going to have our two guests hold off and we're going to introduce you when we get into the content because I want to spend quite a bit of time with you ladies really talking about who you are, your roles. So we're going to pause on that. But as far as who's in the room right now, we've got predominantly the FQHCs, 60% FQHCs. We've got about 20% hospital. And then next we've got the 340B friends and family, as we like to call them, vendors, consultants, and then a few of the other grantee types as well. All right, and then we'll jump to the next poll question, Lanika, if you want to do that one.
Sure. So we try to keep these poll questions really interesting. If you were going to run for an elected position, what office would you run for? Would it be president, federal house or senate, state house or senate, school board or local office, president of book, brunch, or a social club?
All right, and ladies, we have to answer these. So I'm Canadian, so I cannot run for president. I'm excluded from that, so I'm just going to give up on all of those other official ones. I'm going to go for book, brunch, or social club. What about you, Sue?
You know, I'm not the least bit surprised at the low vote for president. It's a tough job, but you know, I would probably go with the school board or local office. We've got school board members on our board of directors for our health center, and I just see what great work they do.
Awesome. Vanessa, what about you?
Yeah, I would say the same. A little fact about me, I have 7 kids, so I would definitely be on probably the school board, lots of them going through the public schools here in Virginia, so that would be my choice.
Yay. Lanika, what about you?
I love to read, so definitely the president of a book club.
That's on my list of like, if I ever need a backup career, I am definitely book club host. All right. As far as what we got back in our results, we did have a few people say they're going to run for president. So you three ladies, well done. Some saying state and federal office. So again, awesome. That's about, for those 3, it's almost 25+%. So way to go, women. We've got lots saying school board, about 34% there, and then the rest saying social club. So awesome. Way to be engaged. So last poll, Lanika, if you want to do this one as well.
Sure. Have you had the opportunity to look through the Sustain 340B Act draft? Feel free to answer in the poll. Yes. I'm working my way through it. I think it's about 51 pages, so you could be working your way through it. It's on my to-do list, or it's too many pages. Cliff notes, please.
All right.
Right now, we have the majority. It's on my to-do list. About 29% says it's way too many pages. So maybe we'll solve that today by giving you a few cliff notes. 14% working their way through it, and 12%, yes, I've read it.
Perfect. And then us ladies, everybody here on the panel, raise your hand if you have read it. Good job. Homework complete.
But
Awesome.
to the one point though, I think it was accompanied by an explanatory statement with the supplemental RFI, and you may speak to this, Felicity, but it at least gives you it is in some ways a Cliff Notes version because it gives you the overarching framework.
Yes, this one, and it's only one, two, I think it was about 13 pages. So it's still relatively lengthy, but when you print it two-sided, it doesn't feel too bad. and the RFI one, we'll talk about it a little bit more too, but it gives you a lot of information on sort of what were they thinking and what do they want to be thinking about more in the future. So we'll jump into talking about the Act. And so we always love to have those great abbreviated titles. So the full title is Supporting Underserved and Strengthening Transparency, Accountability, and Integrity Now and for the Future of 340B Act. And that's shortened to Sustain 340B Act, which rolls off the tongue a lot better. And so it's a bipartisan bill that's been put out, and it's a draft bill. So it's in discussion. And for those of you who read it, one of my favorite sections just said TBD, right? And then said, hey, we're going to ask you questions about this. Please give us some information. And so they, leading into it, there was a request for information, and they got over 250 responses. Those responses have not been made public, but were used by the group of senators who have been working on this to inform what went into this draft legislation. And then there's been a second RFI that has come out with this draft discussion legislation. So we're going to talk quickly. These are the senators who are involved. We've got a mix of both Republicans, Democrats from states across the country. Shout out to you if your senator is on this list. These are an amazing group of collaborative senators who have done a really great thing getting together, putting this bill together, which is collaborative and bipartisan, and something that, we'll talk a little bit more about, but we were all very nervous to see an opening of the 340B legislation, and so well done on their part for taking that on. So there is a lot of information in here. There's a lot of information in this draft bill. We're going to hit the highlights. Rebecca will load a handout that's going to have all of this information from the slides in a 2-page document that's really going to hit some of the key points. Again, encourage you to take the time to read through the bill. It's very important, particularly as it talks about the contract pharmacies and the child sites for us as the covered entities. There are lots of pieces that are program operation that are also important to understand. But if you're thinking about responding to the RFI, those are 2 really key areas for you to dive into to see what is being said there and how that might apply to your organization. So first of all, what we don't have on this, but that is really key to the Act overall, is that it codifies the intent of the 340B program. So that is not controversial. So it's not here in something that we may want to provide feedback on of, you as covered entities or you as stakeholders may want to have input on making changes to it, but they've really taken the intent of the 340B program and they have codified it in legislation, and that is phenomenal. Okay. But when we're thinking about the contract pharmacy piece, that is something that has existed only in guidance previously and now is being moved into the 340B statute. So that is fantastic because that helps reduce our risk of litigation or risk of different bodies imposing their own ways of regulating the program. And so really thinking about the language has pricing protections similar to what we may have seen within Protect 340B Act that was submitted a couple of years ago, as well as what we may have seen within some of the state legislations, right? So making sure that we're not having loss of access at the contract pharmacy for covered entities. It does have a request that we're submitting contract pharmacy agreements to HHS. That's a little bit novel and different. Previously, we've submitted those to the Office of Pharmacy Affairs, perhaps in a desktop audit or in a HRSA audit. But this would be all contract pharmacy agreements would be submitted. We're also, there's a little bit of change about how the contract pharmacy registrations would occur, both under the parent and the child site. There's discussion about clearinghouse for data to be submitted to make sure that we don't have duplicate discount issues occurring. Most notable, and what we've highlighted here, is that 10-year record retention period. Historically, and the reason we highlight this is that HRSA in some of the other areas of the agency has an established 3 years records retention that has been essentially an unofficial standard in the 340B program that we've used. We've also seen manufacturers in their audits use a 3-year look back period too. So this 10 years is a pretty big shift, not to say that it's not appropriate. We do have other agencies as far as some of our pharmacy standards that have a records retention period this long, but it's a little bit different from what we have used as our unofficial standard over time. So just calling it out because it's a little bit different. I already gave you the insight to this one. Patient definition, it's the TBD, to be determined, because there's so much happening with this right now, right? We've just had the Genesis ruling in November, and the group of 6, the gang of 6, however you'd like to refer to them, the senators who are working on this want feedback, and they want to better understand what's going to make sense to include in patient definition. And they have some nuanced questions that are really to the level of the different types of covered entities and the different areas we serve. And so that piece is just a big open space that's waiting to be informed. If you are a hospital, and the draft legislation calls out some specifics on what's a child site, hasn't been addressed before in the statute. There has been some guidance that has talked about this. There's also been directions for the registration, but this is really, again, making solid within the statute. What does this mean? What does this look like? Very, very, very detailed. I will say I was happy that I'm not a hospital, but it provides a lot of clarity on how do you know if you're a child site or not. Or I always think of that children's book, Are You My Mother, right? Like, this will let you know, is that hospital site your parent site, yes or no? It provides a ton of clarity. Some simple pieces to call out: must be wholly owned. You must offer the same financial assistance. And there's a few other pieces. There is one piece that talks about the providers having to have clinical responsibility for the healthcare services related to the 340B drugs dispensed within the child site. And so that's an interesting nuance that occurred in the child site language that may be construed more to patient definition. And so that's a bit of an anomaly in the way that this is written, right? In that the rest of the areas don't really touch on eligibility. This is one small caveat that may give a little bit of insight into patient definition and where things may go. Talking about the records and how records are going to be perceived. So whether it's a shared medical record or readily accessible. And they are going to have to come up with how to handle if something was previously construed as a child site and no longer is. So that's the start. Those are the two big ones that are, if you're a covered entity, be thinking about those. They're the first 2 sections in the Act. Read those for sure. Make sure you're taking a look at that. The next pieces are so important. They're going to impact all of us. And we're going to have to do these things, but so if you only get through the first few pages, right, like get through those, because these are things that are going to come. We're going to have to do them, and these are really important. So make sure you're reading those first 2, because they're going to be really impactful. You may want to weigh in on those. These you may want to weigh in on as well, but these types of things are coming, right? This is part of what has to happen within the program. So there are going to be annual reporting metrics for those who have Medicare cost reports. That's going to happen within the context of the cost report. For those who don't, you're going to have a separate way of reporting in. Not going to go any more deep than that, but the basics are there. The integrity is really going to be looking at strengthening audits and having what we should all be really excited about a published audit protocol, something that we have had asks for across the 340B space for quite a while, but really having visibility into more than just the data request list that HRSA is putting out each year. And then the last piece, which we've been talking about for quite a few years, conversation started with, again, with the Protect 340B Act, is that clearinghouse that is going to help inform duplicate discount. There are a few other pieces that are mentioned in there that could be, the data could be used for as well, all neutral purposes and very explicitly clear that the party that will be doing the clearinghouse must be a neutral party. So information there. And then last few pieces, right? We've got equitable treatment, and that's an overarching way of saying things like PBM protection, anti-discrimination, so making sure that we as covered entities are not being excluded from payer contracts. A user fee, which is saying that there'll be a very small percentage charged to covered entities based on the discount that we receive. And this is something that I personally want to weigh in on how this is calculated, because I think that the 0.1% makes a lot of sense. But the strategy, I think maybe there might be a more direct strategy for how do we get this fee from covered entities that doesn't create a lot of barriers and doesn't feel like April tax time to everybody. So I think that this user fee is really important to help strengthen the system. I think it's been proposed a number of times by different people, but if we're going to make comments, maybe how do we do this efficiently? And then the last piece is talking about conducting some studies. And what we didn't mention, which is an overarching theme, is that for many of these areas, HRSA is now granted regulatory authority, which again is a big deal. HRSA currently only has regulatory authority over civil monetary penalties, 340B pricing, and the administrative dispute resolution process. So we've mentioned the RFI. These are the areas they've specifically asked to hear about, but I'm sure they'd be happy to hear about anything you would also like to give information on. And with that, I'm going to take the slides down and ask our lovely panelists, Sue Veer and Vanessa Ganon, to introduce themselves. So I'm going to stop sharing this. So Sue, would you like to go first? Because you and I have been friends forever. So I'm going to give you the first bill.
It feels like forever. It really does. My name is Sue Veer, for those of you that have not met me. I'm the CEO at Carolina Health Centers. We're in what's called the Lakelands area of South Carolina. We cover 7 rural counties. We're an FQHC. We have 12 medical sites. And serve approximately 25,000 unduplicated patients. Our pharmacy program was started just when I was recruited 17 years ago. We were just starting a pharmacy program, and it's been a journey. We now have 2 community pharmacies that fill approximately 400,000 scripts a year. And we do serve all of our sites through a courier service that we were able to get state legislation to allow. And we are an open pharmacy, so I have to specify that particularly when I talk about our volume. But through both our entity-owned pharmacy and our contract pharmacy models, we have about a 78% capture rate, which is wonderful for our patients. Got involved in 340B, gosh, it feels like 2 decades ago, but it hasn't been. But started going to 340B coalition meetings, and my goal very early on became my staff helped me recognize that pharmacy has to be a core component of a primary care medical home, or we don't achieve the outcomes that we are known for as FQHCs. And so many years ago, my goal was to start really promoting that with my colleagues, health center leadership, who oftentimes, I will tell you that the CEO who was here before me, when he told me, well, we have a pharmacy, we're developing a pharmacy, but you don't need to worry about it. It kind of runs itself. It's like a separate business. And we that we don't achieve what we need to unless we're fully integrated. So that's kind of how I got into 340B. Have had the opportunity to testify before Congress now, twice on 340B and once just on health centers, but they asked questions about 340B. So it's been quite the journey.
You are what I would say a lot of people want to be in the health center space when they grow up. So you are definitely a role model to a lot of us. And I also want to say thank you for everything you do to champion pharmacy within the 340B space. Vanessa, you are a brave woman, and I would love for you to introduce yourself.
Sure. I don't know how you follow Sue. I'm not sure I have such a esteemed background, but I'm happy to introduce myself. I'm Vanessa Gannon. I lead the issue advocacy team at Genentech. And I'm sure folks are like, what does that mean? My role here in the company is really to work with external stakeholders as we try to develop policy and move legislation. So I have the privilege of working with Sue over the years and others as we sort of work to find where folks are on 340B. I have worked on 340B for about 11, 12 years. It is an issue that is important to the company, but it's also very important, obviously, to the patients that we try to serve as well with our medicines. And it's been a journey for us, I think. And, and we'll get more into this, but it certainly is a place where we've always been very interested in understanding the different perspectives, how people are utilizing the program, what it means to the communities that they're working in and the patients they serve, and really trying to find out how we can work together to find some sort of compromise on something that's so important for all of us. So
awesome. And I'm going to ask a few questions that are a little more formal, and then we're going to really get into conversation. But I want to highlight the working table, the 340B working table that you're a part of. And then you all are working with Levitt Partners, who is a registered lobbyist group that helps support the 340B working table. Can you tell us a little bit more about the genesis of the group and about what brought your organizations to the table?
Well, I'll kick it off, but Vanessa, certainly jump in anytime. Vanessa and I have become friends, not just colleagues, and working around the table for now, 3 years. It's we like to dialogue, but I mean, many of us have been working with our various trade associations on this issue in the past, but I think when you're working within your stakeholder group, you are not having the opportunity to truly understand how the other stakeholders are thinking about this, and I think that for me, that's why and I loved the name Working Table, because we weren't like forming an organization, or we just get around the table and work on the issues. And when I was invited, it was literally the first time, I think, that I got to sit down and understand from the manufacturer's perspective how they saw this program, and then the opportunity to get into the weeds on some of the very weedy issues, and share our reality. What is our reality, and really understand how those things come together. And I think I finally came to grips with the fact, after the first maybe 4 meetings I went to, that we can't have a single stakeholder solution. We have to really come together around consensus for this program.
Vanessa, what are your thoughts? Because as coming from the manufacturer standpoint, what's it been like for you?
Yeah, I mean, I echo much of what Stu said here. I mean, I think our perspective is you can't make good policy in a vacuum. And we all sort of understand where our trades or our pillars are on these issues. But I think we're really interested more in solutions. And part of being interested in solutions means you don't get everything that your pillar wants out of, like if that's the way the world worked, it wouldn't be lovely, but many of us probably wouldn't have jobs in DC either. So I think, it's for us, it's like, as Stu says, like you understand because you read things and you try to get a perspective from what does a covered entity think of this, or what does, someone in a small community or rural community or urban setting think of these things. But you truly do not understand that until you spend volumes of time. Like, how does it work here? How does it work there? Like, this policy doesn't work because we don't have that mechanism in a EHR, or that doesn't work because our patients have to go here. And I think a lot of times, we just make assumptions because we get market data or other things, and you have to paint a broad picture. Being able to be at the working table, you understand people as individuals. You also you deeply understand their business, and you really try to think, okay, where can we give, and where does it, where can't you give? And I think all of the work that we've done with the working table over the last several years is being vulnerable. All of this is, you have to be kind of vulnerable, because I think in the 340B space, there are a lot of areas where we can find consensus, as we have found, but you have to be open and willing not to just stand on your side and try to protect the piece, right? And I think that's for all stakeholders. So part of what's been so magical, I think, is just people being very open and sharing and being vulnerable, and then recognizing that and trying to find a place where we can all land that we feel good about.
And you guys have had growth in the working table, right? So at first, Genentech was the only manufacturer. And I'm going to put you again in the hotspot, Vanessa. So who are the other manufacturers? Because one of them is difficult to pronounce.
Oh, yeah. So Novo Nordisk and Eisai have joined the working table, and that was, I think, disclosed in late December, right? So,
Eisai was the one I wasn't quite sure on the pronunciation. Thank you. I will be practicing that offline. And then you have so Sue's at an FQHC, but you now have additional FQHCs and hospitals as well who are on the working table, correct?
Mm-hmm. Correct. And actually, I'm glad you mentioned the hospitals, because when Vanessa was talking about, we understanding the perspectives, I understand the reality of how things work in my health center and in a health center similar to mine. But if you have a large hospital system, sometimes we've gotten into very detailed discussions about a specific process or an operational issue. And it's eye-opening to realize the barriers, or the how the other type of covered entity is doing something. But yes, hospitals, health systems, and FQHCs. When we have it, and I will tell you, we've intentionally kept it among the partners that are actually operating in the program rather than the trade associations, largely because of what Vanessa said. They are kind of that they have no choice but to put their pillars up and stand for all their membership.
Yes.
And that can be a barrier.
I'm going to pause the conversation for a second, because Lanika, I know we've got a few questions that we want to put to the audience and have them put in the chat. Do you want to ask a couple of those?
So we want to know what the audience is feeling about the bill. Your positive, the things that you find positive about the bill, feel free to drop it in the chat. What are some of your concerns dealing with the bill? And then other areas that you may want the bill to address, feel free to drop it in the chat. We'll throw some out to the panel as we go along, and I'll turn it back over to Sue to get started.
So thinking just to bring it back, right? So your working table started more as a discussion group, right? Like we're experiencing these challenges. And so I think there was a lot of work that happened before the RFI came out. But then did the working table respond to the RFI? Is that how you all became engaged with the bill itself? Because my understanding is you have been engaged with the 6 senators. Do you want to tell us a little bit more about that?
Sure. Well, first of all, keep in mind, one of the hospitals is in Senator Thune's district, which is sort of a natural. It's a large hospital system, but we so yes, through our individual contacts with members of Congress that are on now what's called the Senate Gang of 6. I think they became aware that there was a multi-stakeholder group that was working to come up with consensus. So it gave us an opportunity. But yes, we also did formally respond to the RFI. And so that's also helped a lot. Vanessa, you can probably add a lot there.
Yeah, no, I think that's right. I mean, I think when we, oh my gosh, it's like in the middle of COVID and trying to like tap into your memory. When we started our conversations, I think they were very narrow of what we were talking about. A lot of it was around sort of the recent changes in contract pharmacy and sort of what cover entities were feeling and some of those decisions. And a lot of it was around program integrity, like what are some transparency pieces? What, it's not like you start with the safer stuff. I don't know how we describe it, Sue. You start with like the areas that are less controversial or less entrenched in the way that, we think different sides think of things. And it's taken a long time to sort of build that trust. And I think when the Gang of Six put out the first RFI, it was a catalyst for us to really start to dig in deeper to some of these, and I say this in a very nice way, thornier issues, and I think this next iteration of the RFI is pushing those conversations more. Like I recall, maybe Sue, maybe you don't, but like patient definition would have never been something that we would have talked about, because in going into these conversations, you sort of acknowledge where are the safe zones and where do we decide we're going to put it to the side. And it was decided very early on that patient definition was not what we wanted to sort of dive into, but you get an RFI and they're asking questions, and they're good questions to be thinking about. And again, I think it pushes the conversation to see where are those areas that we could find consensus, and there may be areas where we can't, and that's okay too.
Yeah.
So we've got one comment from Lacey. Hey, Lacey. And she's saying she feels like it's like close to the best deal that we can get between what the covered entities would like and what the manufacturers would like. And then just sort of paraphrasing, just looking for a little bit more guidance around or guardrails around what HRSA's authority looks like. So I take that as an overall positive feedback on what we've seen, which is definitely where I sit. I think this has been a really transparent process, right? Going through the RFI first, publishing a draft bill for discussion, and then doing the second RFI. I was telling somebody the other day, it feels like a masterclass in how to do legislation. We've had experiences where bills have been published without, really understanding what's in them. And that never feels good to anybody, whether you're on the bill side or not on the bill side. This just feels collaborative. It feels like, even if it's not perfect, that we all have an opportunity to say what we need to say and voice opinions. But what do you ladies, having been more involved, what do you feel like has gone positive? And I'll start with Vanessa. What do you feel has come positive from this iteration so far?
Well, I do think that you're right, and that it's been pretty transparent. People have had I would think fairly equal ways of engaging and providing information into the RFIs. And I'm sure there have been stakeholders who've met directly with offices. And I think the first discussion draft was pretty balanced. There are definitely areas where I know some of my industry peers would like to see more. And I'm sure on the covered entity side, there are areas that they'd like to see different things come out of it. But I think this is a really hard area to legislate on. If it was easy, they would have done it multiple times, right? And so I think they hit the right tone and the right balance. And I think, I'm not sure everyone on the industry side feels that way always, but I do think that this is a really good step forward in trying to move some legislation on 340B. I don't know, what your thoughts are.
I totally agree. I mean, the day that it was released, we were all like, none of us could work. It was, it's we didn't even. It's like, wow, and it almost felt like a weight had been lifted off. And for me, one of the things that stood out when I first read it was, the lack of statutory clarity is what has gotten us to where we are today.
Yeah.
And I think 4 times in the first 2 pages of the explanatory statement and supplemental RFI, they speak to achieve statutory clarity or to, because we lack statutory clarity. So to me, that was one of the most exciting things, is trying to look that they really care, and they've had discussions with, I can't remember how many, I think out of the first RFI, they decided to have meetings with 20 respondents.
Nice.
And they've taken that and really worked through it. And so for me, that was it. I'm like, that's just amazing that we are working towards, and you mentioned it, Felicity, intent of the program, starting with that, because that's the foundation. If we all understand what this program is intended to do. Now, the elephant in the room, we know that the challenge, the challenge and a lot of the work that we're doing is because we need to have statutory clarity that prevents misuse of this program, what we call bad actors. At the same time, we want to balance that with ensuring that those guardrails that we put in place don't compromise the ability of those who are good stewards of this program. So that's where I think the hard work will be, is getting into that nitty gritty. So really excited about it, though. I agree that it's very balanced and it's the right step forward.
Monica, what are your thoughts? Having read through it, working with a lot of health centers, what are your thoughts on it?
A few things, being excited about it, removing the manufacturer restrictions from our health centers and hospitals. And just the clarifying the patient definition piece would be very important, I think, as well.
Can I respond to that real quickly? We had a recent discussion, and we've come to start thinking about it as like a three-legged stool, where you've got contract pharmacy, patient definition, child sites. But to me, the glue that holds it all together is the transparency. And somebody in a recent discussion said, if we get patient definition right, then it really alleviates the need for a lot of restrictions in other areas.
Yeah.
So to me, between patient definition and transparency, if we get those two things right, then it's going to have created guardrails in other areas.
So I don't know if you ladies are watching the chat, but I have a split focus, and so there's been quite a few things popping up. One of the big pieces that I've seen pop up a few times is around the user fees. And I don't know if any of you enjoyed the cult classic Office Space from the 90s, but you know how they write the computer program to siphon off tiny, tiny percentages of money, but it doesn't go right. And then all of a sudden there's just way too much money. And now what are they supposed to do? Right. So every time I read about the user fees, that's immediately what comes into my brain. And the first time I read it, I'm also, full disclosure, dyslexic. So my brain processed the 0.01% as like the mathematical calculation. So I translated that as to 1%. I was like, whoa, that's a ton of money. And I was like, so I always chuckle when I read that. But so we're seeing a lot of questions about the user fee, right? And so one of the questions that came up was, why not the manufacturers? Well, the manufacturers are already carrying the discount off of their regular price to the 340B price. So I would suggest that maybe it's not necessarily appropriate for the manufacturers to carry the burden of the user fee as well, because they are creating the benefit of the program, because 340B isn't funded by the taxpayers. It is really sustained by the manufacturers. So that's one. But two, part of what we have planned in our suggestions back is ways to still have the user fee, but maybe make them more amenable, right? So things that don't feel so bad, right? So having to do a 5-year look back, create an average, and then calculate what that difference is. Geez, doesn't that feel like April tax time? Ooh, it feels awful. I'm not loving that. Okay. But if you think about, I always think about that Apexis graph where it's like, here's your WAC price, here's your this price, here's your 340B price, right? And on average, 340B price, it's about 50% of WAC. So if you use that as a surrogate, why not 0.01% of 340B price? Why not have the wholesalers apply that? Do it like a little tax, and then have the wholesalers send that right to HRSA. So it all happens behind the scenes and people don't feel it, when a tax happens in a way that people don't mind it as much, then we don't have to do this back calculation. So we're going to put that in as our suggestion of, yes, let's do it, but let's make it slightly less painful for everybody. But just like, I think there's a lot of good things in there, and we do need more support for OPA, would be the other piece I would say. OPA is an underfunded department. They need help. And we have not seen that they've got funds allocated to them in the different years. And so the user fee, it does make some sense for us to help sustain the program accountability. And it's 0.01%, okay? 0.01%. So just to put a conversation piece there. Anything you ladies would like to add to that? I think we can make it better, but I think it's important.
Well, I think my response right away is what we have in front of us today is a starting place, and we do have a real opportunity to not only convey the areas that we see are not going to work ideally, but our suggestions for what will work ideally. Mm-hmm. And so I would encourage people to look at that. And, and I've been following the chat a little bit and understand. So, for example, the clearinghouse is that ESP all over again. And I think part of what we have to look towards is what are the differences, and the fact that this would be independent of any businesses. It would be an independent clearinghouse. In terms of affordability of the fee, I immediately, when I first saw it, I started thinking about the costs associated right now in my system of managing with all of the manufacturer restrictions. And so there's an offset there if I'm not having to do that. So yes, that's how I looked at it.
Lori chimed in that if it means the manufacturer restrictions are lifted, she is more than happy to pay her 0.01%. Thank you, Lori, for chiming in. And again, there's going to be give and take in this, right? There's going to be give and take. Another piece I think that's really important to talk about a little bit more is that clearinghouse and the intention around the clearinghouse, because there's very specific language written into the bill to ensure that the clearinghouse is a neutral party. And do you guys, Vanessa, do you want to talk a little bit about, your impression around that? And if you have any insights on the intention of why that neutrality language was so important?
Well, Sue's probably a little bit more informed on sort of the operational pieces of this, but I think in terms of sort of our perspective on some of it is it's been very challenging to figure out how you keep the discount within the covered entity and not all of these other folks picking it off in some ways. And while it's very imperfect, and I understand the concern, we all have concerns about government coming in and the bids and all of those things. It also felt like a place where if you didn't allow for that and more structure around that, that the incentive to monetize the clearinghouse in some way was a risk, I think. And so I think it gives everyone the itches, I think, definitely, as someone said in the chat. But I think it's necessary. I do think it's necessary, and I think the sort of structure around it is really necessary. But I don't know, Sue, what your thoughts are.
And quite frankly, for me, it's for me, the clearinghouse is all about making sure that there are no influential backers to the clearinghouse, that, for example, in terms of research, data, all of that we struggled. We held out submitting to ESP for a very, very long time, and largely because of those questions about, the ownership of the company and, any research connections. And you really need, I'm comfortable with a clearinghouse if we can truly have confidence that it's independent, and is not going to, for example, be producing research that is geared one way or the other.
I've got a question, because as I was reading through the bill, right, Lisa Schultz brings up a point that the draft covers the clearinghouse and the conflicts really well. But what was interesting is it actually created one conflict for a very neutral party that has served the 340B program really well, which is the prime vendor program has contracts with covered entities, essentially all covered entities, and all manufacturers. And so the contractual language, while it's meant to prevent conflict, would actually mean that the prime vendor program, who is neutral by being contracted with the entire 340B space, couldn't serve as the clearinghouse. So that's something that I'm curious about, and again, a place where we're going to be providing feedback in our response to the RFI is that there may need to be some sort of concession made that would allow potentially for the prime vendor, again, because the intention is to remove conflict, but because of the nature of their role, they're contracted with the entire space. So because they have historically been a great group to have running many aspects of the 340B program, right? The contracting piece and supporting different elements. And if you're thinking about a neutral party who has not done nefarious things with 340B data, right? Like who would be your poster child for that? So that was something that popped up to me that was like, ooh, well, my top pick now is conflicted out.
Yeah. Well, and I several people have talked to me about that, particularly last week at P&I. It came up a few times, and I think it's that is a dilemma. And I think it's important for us to step back and realize that even as thrilled as we all were when this discussion draft and supplemental RFI came out, there are still a lot of places where we are dealing with dilemma. And, how do we address this without having this, this problem? It's certainly within patient definition. You can get deeply into the weeds and, debate it for hours about things like, and I'll just say it, referral prescriptions. Who, if there are multiple providers from multiple covered entities serving the same patient, how do we address the appropriate allocation of that contribution from 340B? Those are dilemmas that are going to take a while to resolve. And it's kind of trying to back up and say, all right, again, but where are the places that we have to meet in the middle and figure out, what will work?
Yeah. One of the items that we saw on the wish list in the chat was somebody saying, because as they're looking at doing the studies of the dispensing fees, was potentially like capping out on what TPAs can charge and what are reasonable fees there. And I think that would be something that I know covered entities have attempted to have the Office of Pharmacy Affairs provide them support on, and they've said that's outside of our jurisdiction, but might be an interesting thing to, again, if people are responding to the RFI, include there. But do you ladies have items that you might put on your wish list that you would, so you mentioned your 3 points of the stool, but are there any other items that you would love to see addressed in this bill? And it's okay to say no, because it's very comprehensive.
Yeah, it is. I hope that they take the comments that come back to them from stakeholders on the RFI, and I guess my hope would be that they attempt to address patient definition in some manner. But it is very comprehensive. It's at some point we got to get some of it implemented, some changes, some implemented, and then you can see but I think they've covered a lot of ground with what they put out.
They did, and Vanessa can speak to the fact that I'm often a broken record about this has to be centered on patients. So, for example, one of the things that when we've talked about if a patient is seeing multiple 340B covered entity providers, how does that work? And I always think about the patient being at the center, and there's 3 C's to that: choice, continuity, and coordination of care. So choice, continuity, and coordination of care, I think, have driven my comments on a lot of things regarding patient definition. And so, yeah, I think they're going to have to. There are some operational details that are going to be very difficult to convey in statutory language.
Yeah. I will tell you, my one wish list item that we're putting in is that to go along with the clearinghouse, that they require a database that's nationally publicly accessible that has the Medicaid bins and PCNs for fee-for-service and MCOs. And then now that it's become appropriate, Medicare, because help us comply with duplicate discount. Please, some states are fantastic. Texas, amazing. Ohio, amazing. And other states, you reach out to Medicaid and they're not even sure. And so I think if we create a database that is required and that they have to submit to, that actually amplifies the success of the clearinghouse, because then we have less covered entities who are set up for failure. And so the data is coming cleaner because we already know what plans we should be blocking, especially if you're in a mandatory carve-out state. So the little things like that, I think, can add to the success and build out the intent. And user fees could go to support that.
Yeah. Well, and one other, I mean, again, I don't.
A million yeses in the chat.
Yes, you hit the gold with that one, I think. Yeah.
Yeah. And I think some of the hard work is going to be around, you build a framework, but then, as we all know, there are always exceptions to the rule. And we've had extensive discussions about the but what if. And so for around contract pharmacy, if the statute were to build some limits on, for example, geography or number of contract pharmacies, there are going to be what ifs. And we've talked at length about, how do you create exceptions for those what ifs, like limited payer networks, specialty pharmacies that are located in, far away from you, that's the only place your patient can go. And that's going to be the hard work once we get this in play. And I think it's important to keep in mind, this is the first step of getting something in play.
Yeah. And it's an amazing, amazing first step, right? I think that there's so much good in it, and there's so much now opportunity for discussion and for people to bring additional comments to be heard. So I'm going to bring back up the slides because it's going to be just asking the poll question, right? Are you planning on submitting to the RFI? And so you're going to submit your own response with your organization, or you're going to sign on to a letter, perhaps with your advocacy group. So maybe 340B Health with NAC, RWC, 340B are just some examples. Or no, you're not submitting, but you appreciate all of the heroes who are. And so just looking to see it's growing. We now have 5 people who say that they're planning on submitting their own response. And it continues to go up. We were up to 6 now. Lots who are saying that they're going to sign on with their advocacy group. So, just really, really awesome. Over half of the attendees are either signing on or are going to submit their own letters. So amazing people, amazing everybody.
And it's really an interesting balancing act, because having met with these wonderful staff of the Gang of Six, you realize how much work they have to do when they get these letters. And so, for example, from the NAC perspective, NAC's writing a sign-on letter, and it makes it easier on staff if hundreds of health centers sign on to that letter. But you also have to recognize that if that letter doesn't include something that is incredibly important to you or to your organization that you want to make sure gets into the discussion, that you send your own response as well. Because, my hope is, and the sense I got, and Vanessa, I think you can correct me if I'm wrong, but the sense I got is they will follow somewhat the same process. Once they digest all of these responses, they are probably then going to have some meetings with some core groups to make sure that they incorporate everything that's necessary.
And Sue, do you have any tips for submitting if somebody was going to send a response of their own? Do you have any tips for what that would be like? Should they just stay targeted if there's a specific issue that they want to address? Just stay targeted there, or how do you recommend responding?
What I did with the last one, because I did sign on to the NAC letter, and I'm part of the working group, so I was in two camps, and they're not opposing camps, which is great. But I acknowledged that. But then if there were a couple of additional comments that I wanted to make, I didn't write all of it all over again. I said, please note that I have signed on to both of these letters. However, I'd like to add these comments.
Awesome.
Yeah, I would echo that. I would also say that I think they're looking for tangible things. We say the devil's in the detail, and the more detail that you might have to share with them, I think they really appreciate that, because we all have sort of philosophically our opinions on different things, but it leads the hard work for them to do about how would they do this, or what about the prime vendor? And I think the more you can be specific, I really do think it helps them tremendously.
Awesome.
And I know we only have minutes left.
Oh, no, please.
I have to say, these are incredible people. The staff of the Gang of Six. I'm so appreciative of the depth with which they've approached this project, this legislative work.
We are so appreciative of both of you, Sue and Vanessa, both for being here. And Vanessa, thank you for being our first manufacturer to join. I believe that our audience was as kind and as appreciative as I promised they would be. Thank you, ladies, all for living up to the very high standard I set for you. And then just reminder quickly, if you're in the grantee space, don't forget about the grantee conference coming up in Arizona. If you can be there, we're hosting the welcome reception. But again, just really encouraging you all to either sign on to letters, write your own short pieces for areas that you want to speak on, and really just super excited for where 340B is taking us now. I never thought we were going to have a opening of the legislation that wasn't completely terrifying, and here we are. Any parting words, ladies?
Hopeful, not terrifying. I love that. Yes.
I agree. Just echoing the comment I see, working together is the way we'll make it better. And I really do believe that. So thanks for having me today, you guys. It's been great.
Yes. And Sarah, as Sarah echoed, Vanessa, you are so brave. Thank you. Thank you, Sue.
Thanks.
Sue's put her email in the chat in case anybody wants to reach out to her. And we appreciate you all being here. Again, if you haven't had a chance to read the bill, please take some time, dive into it. They are very narrow pages, so it's not quite as long as it seems.
Yeah.
All right. Have a great month, everybody. We will see you next month. We're going to be discussing some hot topics, maybe some legislation again. We'll see what happens. We'll see where the month takes us. All right, bye, everybody.
Thank you.